Hey everyone, Dr. Glynn. So one of the things I get asked is what are the things that I really should be doing to try and increase my chances of being successful after weight loss surgery. So what I tell everyone is three things. Okay, there are three things that in all my years of experience, all the patients that have been successful having weight loss surgery, they have these three things in common. Okay, now before I start, I know there's a lot of videos that you might see that might say like, you know, the three things to guarantee success, or, you know, people are looking for these magic formulas. What I'm going to tell you is the three things I'm going to tell you, they're pretty much common sense. There's no rocket science behind it, but they are the three things that I've seen over the years that everybody who's been successful in weight loss surgery have in common. Okay, so the first one is your support system. Now, your support system is the most important thing that you need to have when you are trying to be successful at having weight loss surgery. Okay, that creates your foundation, that creates your base. If you have a good support system, then that is going to allow you to be able to handle or deal with anything that comes your way that might be an obstacle for you. Okay, now the support systems, when I talk about support systems, they need to be large, they need to be diverse, they need to give you lots of options. So they might include family members, friends, co-workers, people in other support groups that you go to or attend, Facebook support systems, things like that. But you need to have lots and lots of different options. Sometimes you might need someone who's going to be able to listen to what you need to get something off your chest, and they're going to be able to listen. You might need someone who's going to be able to give you that kind of encouragement and that pep talk. You might need someone who is going to just kind of like give you a kick up the backside when you need it and you're feeling a little bit down and feeling a little bit sorry for yourself. But your support system needs to be large, it needs to be diverse. It might also include paid professionals. You might have a therapist. Your nutritionist is part of your support system. Your support system is anybody that is helping contribute to you being successful. Okay, so that's the first thing. The second thing that is really, really important, okay, is that you do your homework. Okay, now when I say do your homework, the one thing I don't mean is I don't mean you have to necessarily watch all the YouTube videos about watching the surgery be performed and things like that. You generally need to have a loose understanding of what the surgery is all about. You don't need to kind of go into the medicine too much, that's for the doctors, but ultimately you just need to know generally what the surgery involves, kind of what your recovery time is going to look like, you know, how long maybe you're going to spend in hospital, what your first few days after the surgery are going to be like. You need to sort of know that, but most importantly what you need to do is you need to really understand exactly what this is going to look like on a day-to-day basis. What's the first 3 months, what's the first 6 months, what's the first year, what's the first 18 months going to look like for me? Okay, and the only way you can do that is by talking to people. So I encourage people to talk to as many people as they possibly can who've had weight loss surgery, because they'll be able to kind of give you a real good understanding of what it's all about. You want to talk to lots of people, you want to get lots of different experiences. Some people are going to have great experiences, some people are not going to have such great experiences, okay? But you want to get as vast and as wide a pool of experiences so that you can really evaluate it and get a nice large sample size, okay? So those are the first two things. And then the third thing, like I said, not rocket science, not reinventing the wheel, is you have to follow the rules. The one thing that separates people who do well versus don't typically is that ability to follow the rules. And what that means is doing everything they tell you to do, and also being aware of whether you're quite doing something accurately. Okay, there are lots of people out there who are making a genuine effort to do really well with the surgery, but there are certain areas in which they're not quite doing as well as they could be, and they're just missing something. Okay, and they're not even aware that they're missing it. Okay, so being honest, and that way support system comes in. People who can keep an eye on you, who can say to you, you know what, you're almost there, but you're not quite there, and you make those few little adjustments, and you can do really well. But you've got to follow the rules. And to do that, you've got to understand the rules. You've got to understand all the things that they're going to ask you to do. Okay, not just the basics, not just the you know, the eating the slow, the chewing your food more, the not eating and drinking at the same time, that sort of 30-minute rule before and after. Those things are the basics, but all of it, everything. Okay, planning your meals out. You've got to plan your meals out. You've got to plan what you're going to be doing. Okay, you shouldn't be going into any day not knowing what you're going to eat for that day. You should always have that plan in mind. Okay, so planning meals, understanding what sort of food you can and can't eat. Okay, and all of that stuff. So you've got to follow the rules. Okay, and like I say, when people are struggling or not doing so well, it's normally because something they think they're doing right, they're not quite getting quite right. So always have people around you that can check in with, can just make sure they can be your eyes and ears as well. Okay, so those are the three things that people who are successful weight loss surgery, in my experience, they all have in common. Now there are lots of other things obviously you need to do, but those are the three big ones. You do those three big ones, it gives you that foundation, that base to go on and be successful. Okay, so like I said at the start, it's not rocket science. I'm not reinventing the wheel. I'm not giving you any magical tips because there aren't. Common sense. You know, 90% of stuff to be successful is common sense. You just do the right things, and these are the basics. You do the basics, the rest of it kind of takes care of itself. And whatever you do, if you get the basics right, the rest of it comes much easier. Okay? Hopefully that was helpful. Please, if you're new to the videos, please check out some of the other videos. We talk a lot about lots of different things to do with bariatric surgery. Please like, please subscribe. Any comments, again, I say it on all my videos, but if there's anything specifically that you would like to hear about, please put a comment in the comment section and I'll try and make a video about it. Okay? Thanks a lot.